Okay, just to be on time, I'm going to go ahead and get started, everybody. I want to say welcome. My name's Vicki Ferguson, and I'm the president of National Benefit Plans. I've been in the insurance industry for over 30 years. Had an office in the Troy, Michigan area for over 34 years. And I still am excited about helping people. I'm excited to educate. I always feel like if I don't really want someone to tell me what I need, I would like to have someone to explain to me so I can help make that decision. And it's something that the industry I've been in for a very long time. So there's always a few different nuances, and we have so many great independent producers that work with national benefit plans that together we all can really help you guys. I'm going to do a presentation, and I don't necessarily expect you guys to become an expert on Medicare or have the knowledge that we do, but it's really important that you understand the basics. And if you're tuning in today and maybe you're just not turning 65 for even 5 or 10 years, to start understanding the basics, it's kind of like opening up a file folder in your in your filing system that you can start putting some of this information in. And the more you hear it, the more you're going to understand. So we're going to start today by just trying to get you to understand the basics about the choices when you turn 65 and what Medicare offers you. Generally speaking, people are very, very happy to turn 65. The coverage is really good, and usually the premiums are much lower than what you're experiencing when you're on individual health insurance prior to 65. So I'm going to go ahead and share my screen and get started, okay? All right, so I'm going to go ahead and get started. Sorry for the technical difficulties, but I'm really happy to be here today at our event. So today we're going to talk about Medicare and just try to get you guys to understand the basics of Medicare. And I also, I'm open to any questions you have. I mean, there's a million different scenarios out there when you're turning 65 or approaching Medicare. So when do you sign up for Medicare? So generally you would sign up for Medicare during your initial enrollment period. So your initial enrollment period is when you turn 65, or if you're disabled, it's 2 years from the date of your disability. So there's those 2 times that you can sign up. So if you are disabled and you're on this call, you also get another enrollment period when you turn 65. So that's always good to know. If you have any family members that are disabled, they will get a chance to make another decision and have another enrollment period. You guys might say, what is an enrollment period? So the enrollment period is when the government actually gives you the opportunity to get into the Medicare program. The initial enrollment period is unique because it's your guaranteed issue. So meaning that your guaranteed issue, meaning there is no underwriting if you were to choose to go into a Medicare supplement. The general enrollment period is also available to you, and a special enrollment period is, let's just say you're working and you decide to postpone your Part B, and you get a special enrollment period, and that there's some nuances to that. So, and I'll talk a little bit more about if you plan on continuing working. So you sign up for Medicare. If you're already collecting Social Security, then you'll get automatically enrolled in Medicare. And your card would arrive about 3 to 4 months before you turn 65. So if you aren't going to collect Social Security and you want to postpone your Social Security, let's just say you want to wait till you're 65 or I'm sorry, 67 or 70 to collect Social Security, then you would also need to sign up for Part B and postpone your Social Security, and you would actually pay your Part B premium monthly. Because normally they can take it out of your Social Security, but if you haven't signed up for it, then you would have to pay your Part B premium. It's really important that you, if you're going to postpone and take your Social Security at a later time, then it's really important that you set up payments for your Part B, because if you do miss those payments, it's challenging to get you back on. So we've helped a number of people that, for various reasons, didn't pay their Part B, and they lost their Medicare coverage, right? And I mean, some of those people had some severe health issues, and so it's important to make sure you pay your premium. So you will have a initial enrollment period 3 months before your 65th birthday, the month of your birthday, and 3 months after your birthday. So if you're not collecting Social Security, then you can sign up 100 days before your birth month. So you can enroll in 2 different ways. You can call Social Security and go to the Social Security office and set up an appointment, or you can go on Medicare.gov and you can sign up there for Medicare. This is what your Medicare card would look like. So they have a special number with contains numbers and letters, and that is special to just you. It would have your Part A effective date and your Part B effective date. If your Part A effective date is different than your Part B effective date, that possibly means that you postponed your Part B. So there's some when you enroll in your Medicare plans, depending on whether your dates are the same or different, we have to do a few different things. But just so you know, I always tell everybody to guard that number. Do not give that number out over the phone. Try to make sure that you keep your Medicare card to yourself. So what is Part A? So Part A is hospital care. You do not get charged a premium. So Part A would cover you if you were going to be admitted to the hospital. It covers you for the first 60 days at 100%. It does have a $1,716 deductible that's projected for 2026, and it covers the first 20 days of skilled nursing. So just so you know, if you choose a Medicare supplement or a Medicare Advantage plan, that does pay that deductible. Part B, as in boy, is you pay a monthly premium for it. So Part A with a hospitalization is what they give you based on that you worked 40 quarters and paid into Social Security, and that's how you qualify for Part A and Part B. So once you take your Part B, they charge you a monthly premium for Part B. Now, originally, in the 1960s, they said, we want to give these folks some coverage, some seniors coverage, and we're going to give them coverage if they're hospitalized. And, it's good coverage, right? Because you're hospitalized, you're not going to have to pay a premium for it. Then they came back and they said, well, hey, we need to give them some coverage for doctor visits, for outpatient surgery, for emergency room, for ambulance service. Those are type things that are covered in your Part B services, and they do charge you a premium. So it covers the medical service outside of the hospital. It includes doctor visits, lab work, x-rays, ambulance, emergency room, and outpatient surgery. It pays 80% of what Medicare approved charges. So it's an 80-20 plan, meaning Medicare will pay 80%, you pay 20%, and there's a $288 annual deductible that is projected for 2026. So that deductible can or cannot be paid. So if you choose a Plan G on a Medicare supplement, then you would be responsible for your deductible. If you choose a Medicare Advantage, the Medicare Advantage would pay your deductible. So Part B premiums are based on income. So it's called IRMAA, and the income for 2026 is $206. I'm sorry, $218 or less. So if you make $109,000 individually or less, you're going to pay $206.50. If you and your spouse make $218,000 together or less, you're going to pay also $206.50. That is per person, okay? And you can see by this chart that if you make over, $410,000 to $750,000, you're going to be paying $660 per person if you do it jointly. If you make $205,000 to $500,000 individually, you're going to be paying $660. So you can have access to any of our documents if you would like them. We'll be happy to share this IRMAA with you. So what do you get with A and B? So with A and B, you get your hospitalization and you get your outpatient medical things, but Medicare doesn't cover certain things that a lot of seniors need. So that would include dental, vision, prescription drug coverage, hearing coverage for hearing aids, hearing exams. Long-term care coverage is not covered by Medicare, and like podiatry is not covered by Medicare. So these are the type of things that are not covered with your straight Medicare red, white, and blue card. If you wanted to delay your Part B, let's just say your spouse is working and she's able to add you to her plan, and you wanted to delay your Part B, you can do that depending on the size of the employer. So the reason I have this slide, and it's very important that you out there understand, is that your employer has to have at least 20 employees to be what they would call qualified coverage. And you can delay your Part B, and you can delay your Part D as in dog, which is your drug card also, as long as they're offering comparable drug coverage. So if you're going to have insurance through your spouse, if you're on an employer group health plan that has over 20 employees, or you're covered under your spouse's employer group health plan, you won't have any penalties and you won't lose any of your options. There are some information like you need to, if you were going to delay your Part B and delay your Part D as in dog, then there's some periods of time that you need to realize. So Part D has to be chosen within 63 days of losing your group coverage, and Part B has to be chosen within 8 months of losing your group coverage. So now you might say, okay, Vicki, you've been talking about supplements, you've been talking about advantage plans. We just had the last slide was on group health plans. What direction are you guys going to go? There's a lot of us that are turning 65 and we are still very energetic. We love to work. We're planning on continue working. You still might want to schedule a call with an independent producer just to go over this and sit down with them so you understand your choices. But you have a choice when you turn 65. You can stay on your employer group health plan. It must be over 20 employees. You can take a Medicare supplement, or you can take a Medicare Advantage plan. You literally have choice number 4, which means you don't do anything, right? So if you choose not to do anything, then you're simply going to have 80% coverage and you're going to be responsible for 20%. Now, would we advise you to do that? Probably not. I'm sure there's a percentage of people out there that don't understand their options, and they might think that when they turn 65, the government's going to pay for their health insurance, and they don't realize that they're going to have to pay 20%. So I actually had a client that called. She lived in the Lansing area. It was exactly in this situation. She had her red, white, and blue card. She thought she had coverage, and she went to the hospital for a gallbladder issue, and she ended up having a $12,000 bill because that was her 20%. So, we helped her to try and negotiate that bill down. We helped her get on a plan that would help pay that 20%. But I'm trying to make you guys understand that you have choices, and that's what we're here for, is to give you your choices, right? So let's just say you're a retiree or you're leaving a union plan. So, you might say, I have a union retirement plan, or I have a retirement plan from my large employer. So some of the things to look at when you're looking at those union plans or the retiree plans, and to make sure that you talk to an independent agent that has your best interest in mind, would be to find out what your copay and deductibles are under those plans, to find out, to make sure those plans include a drug plan, because we don't want you to get a penalty. And if you wanted to leave that plan, could you go back? Because some people might recommend that you move to an Advantage plan with them, but they don't take into consideration that if you opt out of that plan, you'll never be able to go back. And we want to make sure that you have the best coverage that's available to you. And some union plans are actually richer in benefits and have a lower max out of pocket. So, we would not advise you, depending on the cost, to leave that plan. So then you would want to find out, how much is this union plan going to cost me? And then does my union plan include, or retiree plan, does it include dental and vision? So, just based on a lot of those questions, we would go through it with you to try and determine if, generally speaking, if you're better off still in that union plan or retiree plan. So what is a Medicare supplement? So Medicare supplement is a standardized Medicare gap plan that's offered in all the states and District of Columbia, okay? So what does that mean? So you have 80% coverage with the government, the Medicare red, white, and blue card. Anything Medicare approved charges, they're going to pay 80%, you're going to pay 20%. The Medigap plan simply picks up the difference of the 20% that the federal government or Medicare does not pay on that red, white, and blue card. They offer standardized plans. I don't know why everything has to be in letters, but their plans are also plans A through N, and they're offered in most states. So you would sit down with an agent or an independent producer, and you would discuss Medicare supplements and how much they cost per month and what they cover, and whether a plan N or a plan G would be most benefit to you if you wanted to go down the Medigap Medicare supplement road, right? Because remember, we were in this slide back here, and this is your road, right? You can go straight, you can go right, you can go left, or you can just stay where you are and do nothing, okay? So let's go back here. So now you have a choice of a Medicare supplement. All the policies are standardized. So what does standardized mean? Standardized means that they're all offer the same basic benefits. So with that said, whether you're in Michigan, California, Texas, Nevada, or on the East Coast, your plan G or your plan N would cover the similar things. They're all standardized, okay? They're not offered by independent insurance companies, but they're a supplement plan. They're going to pay the 20% charges of Medicare approved charges. So Medicare's got to pay, then they're going to pay the 20%. Does not include any drug coverage, your med sup, okay? So when would Medicare supplement be the best? Okay, Medicare supplement would be the best if you want to know exactly how much you're going to pay, because if you want to budget your Medicare medical costs, you're going to know that if you pay, $170 per month, that your 20% is covered. If you're going to be traveling a lot and you're going to be needing to see doctors that aren't in your home state, that's a good choice, would be a Medicare supplement. Now, there's plenty of other Medicare Advantage plans that do cover you if you're out of state, in different situations. But generally speaking, these are the reasons why you might want to choose a Medicare supplement. You can see any doctor or specialist without referrals that accepts Medicare. Now, there's a lot of doctors out there that either aren't taking new patients or might not accept Medicare. But generally speaking, you have a large network of doctors that accept Medicare and specialists without referrals. So the plans will help pay some health costs that Medicare doesn't pay. So, if you chose a med sup, this med sup would pay your deductible and coinsurance and some co-payments, like that $1,700.16 on your Part A. So that it helps pay those costs. And you can keep it as long as you pay premiums. So the premiums on Medicare supplements do go up based on your age and geographic area. So sometimes if you do move to another state, it'll affect your premium. So just something to think about, okay? when would you want a Medicare Advantage, and what is a Medicare Advantage? Okay, so Medicare Advantage is Part C. So a Medicare Advantage plan is your Part A, your Part B. Remember, Part A is your hospitalization. Part B is your outpatient services, such as doctor visits, outpatient surgery, emergency room, ambulance, those type of thing. So, and then Part D is your drug card. So Part C was created to cover Part A, Part B, and Part D into one plan. It's called MAPD, Medicare Advantage Prescription Drug Plan. Okay, it is written by independent insurance companies. So imagine that the government says, why don't we contract with independent insurance companies? We can give them the red, white, and blue card. We'll give them their red, white, and blue card. They can manage the costs, and we'll pay them so much per month per enrollee. So that's really about, and they have a lot of rules and regulations, and Medicare Advantage plans have to pay what Medicare covers. So any Medicare approved charge has to be covered in a Medicare Advantage plan. So they're very popular. They have low premiums or no premium, and you contract with an insurance carrier. Let's just say an insurance carrier could be Blue Cross Blue Shield of Michigan. It could be Health Alliance Plan. It could be Humana. Those insurance companies then offer you plans. These plans are available to you for a 1-year contract. You can choose a PPO plan, an HMO plan. There's HMO POS plans, and you get a network of doctors to go see. You have to abide by the rules of those plans. So you have to stay in network. If you do have a plan that allows you to go out of network to PPO, there might be a higher copay for those choices. And generally speaking, they have really broad networks, especially in Michigan. So usually it's a good choice, but it's not everybody's choice. That's why we want to educate you guys. It also includes a max out of pocket. So let's just say you took a Part C plan and you chose a plan, and we can just call it, we can call it the Great Lakes Plan. We can call it any name you want. So let's just say we call it the Great Plan, and you choose that plan. You're going to have a schedule of what you're going to pay. So you might have a zero premium. You might have a $0 to go see your primary care physician. It might cost you $45 to see a specialist. All these plans are different, and we won't be talking about any specific plans today. But if you wanted to talk about specific plans, we can definitely do that. You just have to reach out, and we would be happy to have a one-on-one and go over all your choices and just kind of give you more of a lowdown on what these Medicare Advantage plans actually offer. But it includes a max out of pocket. So sometimes deductible, coinsurance, max out of pocket, everybody gets some of those terms confused, but a max out of pocket means the most you're ever going to pay is called MOOP. So MOOP, okay, is maximum out of pocket. And that means the most in any 1 year that you're ever going to pay on that plan might be 4,500 or 4,000, or it could be 6,500. Some states they have lower max out of pockets. Some plans have lower max out of pockets, but in any situation, the most you're going to ever have to pay is the max out of pocket of Medicare approved charges. Just remember that. So this slide is just going to kind of give you an idea of what the difference between an HMO plan, a PPO plan, or a POS plan. So sometimes in Michigan, we have HMO/POS plans. So I kind of wanted to just put this slide in here for you guys because, honestly, I just want to help you kind of understand these terms. And if you guys are new to Medicare, or if you're just like refresher, the more you hear this information, the more you're going to understand it. It's just like anything else. So, and if this is a review for you and you already know this, I'm going to apologize because I'm probably talking, at a level so that everybody can at least learn. So an HMO is called a health maintenance organization, and it generally gives you coverage if you use medical providers who are in network with the plan, other than emergencies. So if you have an emergency and you're in another state or you're up north and you're out of your network, you can go to anywhere if you have an emergency and it covers you. You have to choose a primary care physician when you are in an HMO plan. Generally speaking, they want you to list a primary care physician, and that doctor will give you referrals to see specialists. Now, I'm just going to say this really quick. There's plenty of HMO plans in Michigan that do not require referrals. So if you're on one that does require referrals and that bugs you, there's plenty of them out there that don't. So just so you know, there's all different types of plans. We have extremely good networks in Michigan. So a PPO plan is called a preferred provider organization. It allows policyholders to receive discounted prices from in-network healthcare providers partnered with the PPO. So let's just say you want a PPO plan. You don't need referrals if you're on a PPO, generally speaking. And PPO will cover you if you go out of network. Now, if you stay in their network, in their PPO network, which is an in-network healthcare providers, your copay will be smaller. So you see on your outline of coverage that if you go in network, your copay is going to be $40. And if you go out of network, your copay might be $80 to see a specialist. But you can go out of network. They're not going to tell you that you absolutely can't. But you do have it does cover out-of-network care, but there is a higher deductible for out-of-network, and there's a higher cost for out-of-network expenses. So keep that in mind, okay? Now, a point-of-service plan requires policyholders also to choose a primary care physician similar to an HMO, and some of them require you to get referrals, but some don't. It depends on the plan, but they do cover out-of-network care if you get referred out of network by your primary care physician. And they do charge more to go out of network. So just so you know, a lot of people are like, oh my gosh, I have to have a PPO plan. I would tend to sit down with you and really discuss that, because if you have a network of doctors that has 80 or 90% of the doctors and hospitals in network, and there's generally a good chance you're not going to be going out of network, especially with some of the networks we have in Michigan. So I wouldn't be afraid of any of these plans. It's all about looking deeper into the plan and figuring out which works best for you and when your drugs are covered. You know, that's another thing. We always have to look up your doctors and drugs. And if your insurance agent isn't looking up your doctors and drugs, then I would recommend that you get another review. So what's the difference again? What's the difference between an HMO plan, a deductible HMO, a PPO plan? So usually a PPO plan is referral free and you don't need referrals. Generally speaking, you have a broader choice of doctors if you're in a PPO plan, and you will have higher costs if you go out of network. And in the HMO plan, you cannot go out of network unless it's an emergency. So, you know, this slide kind of gives you a little bit of information so that you can understand that the difference between a PPO, a POS, and an HMO plan. You know, HMO plans usually are lower out-of-pocket costs. They usually have a lower max out-of-pocket. And a POS plan is a great choice because it kind of gives you the blend between an HMO and a POS, and a PPO. So you can go out of network at a higher cost if you really need to. You still need a primary care physician. In a PPO plan, you're not required to have a primary care physician, but a lot of us have worked with the same physician over the years, and we don't mind having that primary care physician. So what's the best path, right? So here we're going to go down I should call this a yellow brick road, right? Instead of a red arrow. But let's go down this road. So why would you choose the Medicare Advantage plan? Well, generally speaking, they're a much, much lower premium. So Medicare Advantage plan is kind of a pay-as-you-go. So I was explaining this to an insured earlier this week that didn't quite understand the difference between Medicare supplements and Medicare Advantage plans. And so I kind of explained it to her like this. So you are really healthy right now. You're only on one drug, okay? Sure, you could take a Medicare supplement plan and you could pay, I believe her premium was like $150 a month. So if we multiply that times 12, that's $1,800 a year. Or you could take a Medicare Advantage plan, potentially that might have a lower premium, a zero or maybe a $25 premium or something. And you could be healthy for the next 5 or 6 years. You know, this could be a better path depending on what's best for you. So the Medicare supplement, you know how much you're going to pay every year, no matter what, because you have you're paying a set premium, and they're going to pay everything, the 20%, and sometimes excess charges over what Medicare charges. But with a Medicare Advantage plan, you're going to pay less in premium. You're going to go to a network of doctors. So as long as you like your doctors, as long as they're in network, as long as you're comfortable with that situation, then you're going to, and you might actually have a better formulary on the drugs with an Advantage plan. And if you're on a low income subsidy for Medicare, an Advantage plan pairs really well with that because it pays your drug costs and your drug deductibles. So there's just, everybody's different. Everybody here has a different income. They have a different retirement plan. They might want to spend, maybe their children live out of state. There's a lot of different things that we all have different situations. And that's why it's really important to just sit down and discuss this and understand it well, because to me, there's power in knowledge. And if you understand how your plan works and you understand that every year you really should be having an annual review if you take an Advantage plan, because formularies change and doctors change, then, you know, as long as you have the power of understanding. So we're going to move on to prescription drugs now. So Part D is for prescription drugs. So, you know, the government, they come along in the early 60s. They decide that the seniors that are over 65, they need to have coverage in the hospital. So they're going to pay for you to go. If you go to the hospital and you worked 40 quarters, you're going to get your Part A, and you only have to pay a deductible. The rest of it is no, there's no premium. Then they decide, okay, we need to help these guys because on outpatient services. So then they create Part B as in boy, and they decide we got to pay a premium on this because we can't, you know, the burden of cost is too high for us. So then comes along, the cost of drugs are starting to hurt seniors. So they create a Part D for drugs. So Part D for drugs is required when you turn 65. If you don't take a Part D drug plan, because this happens quite a bit, people might turn 65 and not be on any drugs. So why would I want to pay a Part D premium? Well, the government tries to, or does actually, you know, years ago I used to think, well, how would they know? But the government knows everything. So it's interesting to me because they know when you don't have your Part D drug card. So you have to, you're number one, you're required to take your Part D drug card. Number two, if you don't take your Part D drug, you're going to get imposed a 10% penalty of the average cost of the drug card, which is about $38. So it'd be $3.80 per month that you don't have your drug card. If you're a veteran and you get your drugs from the VA, you're not required to take a drug card. If you're on, if you're going to continue working and your employer has over 20 employees again, and they're offering you comparable drug coverage, approved drug coverage, then you don't get a late penalty. Some of these drug cards are included in your retirement plans. You should definitely double check that and make sure. Okay. But Part D is for prescription drugs. So there's such a thing as called extra help. So these would be for folks that have a lower income, and you need to apply for that. And so the unfortunate thing is there's many, many seniors out there that aren't advised or aren't helped to apply for this low income subsidy. So if you were to bring your, I don't care, your sister, yourself, your family member to me, we would definitely go over this low income subsidy and make sure that if they qualified that we help them apply. Because if you have an annual income in 2026 less than $23,475 for singles or $31,725 for couples, then you will get extra help with your RX. You also can't have more than resources, like you can't have a bunch of money in the bank, or you can't have a lot of assets. So this is 16,100 for singles and 32,130 for couples. We can also help you with deductibles. This can also help you with deductibles, copays, and premiums. So this just shows you what the Part D drug cards worked for 2026. So in 2025, they've removed the what they would have called the donut hole. So if you guys are turning 65 after 2025, you will never have a donut hole. So they have a deductible. They can insurance companies can have a deductible up to $615. Some companies do not have the deductible on tier 1 or tier 2 drugs. Some have the deductible on tier 3, 4, and 5. Some have the deductible on tier 4 and 5. But the way this works is you would have $2,100 out of your pocket that you would copay during your initial cover period. So let's just say you're on generic drugs. Generic drugs are tier 1. Some other brand name generics are tier 2. They're all these drugs, each drug company has a different, each drug plan has a different formulary, and that's what the drugs are. So as long as you're on tier 1 and tier 2 drugs, generally speaking, you're just going to pay a small copay. Sometimes it's $2, it could be $5. And so you're not going to really have any problem with this maximum of $2,100. But if something happens and you get on a very expensive drug, maybe it's a tier 4 drug, your plan might have a 25% copay. Let's just say if your drug costs $10,000 the first time you fill it, you would be out of pocket $2,500. You would pay $2,100 and you would meet your maximum out of pocket. So, and that's when they call the catastrophic range. So once you spent $2,100 out of pocket, then your drugs are all covered and you don't have to pay a co-payment, co-insurance on Part D drugs the rest of the year. It's pretty simple to explain, but if you have any questions, please give me a call, okay? So this is just what happened in 2025, just a summary of some of the information that that happened in 2025. So drug costs in 2025 were $22,000, and in 2026 they raised it to $2,100 annual cap out of pocket for your drug costs for Part D. Once you reach this $2,100, you will not have to pay any additional co-payments or co-insurance for coverage Part D drugs for the rest of the year. Also in 2025, they started negotiating drug prices that took effect in 26. So there's 10 drugs out there that have been negotiated. And if you're on maybe Eliquis or Stelara, those are a couple of the drugs that have been negotiated for a lower cost. And they're planning on increasing to 15 more drugs in 2027. So they're really trying to work with the pharmaceutical companies to bring down some of the drug costs. They've expanded access to vaccines. So all adult vaccines are now covered under your Part D with no deductible, no co-payment. And if the carrier gives you pre-approval for some drugs, they can't come back. This is brand new for 2026. But for example, you might get approval for a certain regimen of drugs or treatments for cancer or something, and you get pre-approval. This rule makes the insurance company honor that pre-approval, so they can't come back and say we changed our minds, in other words. So if it's pre-approved, then they're going to pay for it, okay, whatever they pre-approved. They also still have an insulin cap of $35 or 25% of the negotiated drug price. So whichever's lower. So if you can get let's just say if it's the negotiated drug price is $45 or $60, let's just say 25% of $60 is $15. It's going to be, you would pay $15 in that scenario instead of $35. So Part D drug coverage, you pay 100% of the drug costs up to $615. Again, remember, those plans vary, and Medicare Advantage plans vary when it comes to the way they cover drugs. Some of these, like Tier 1 and Tier 2, don't apply to that $615. So you have initial coverage phase. Once you meet your deductible, you pay a portion of the drug costs. Usually it's 25% until you hit your coverage limit, but every plan's different, so it might not be 25%. I can't really talk to specific plans. During your catastrophic phase, once you've spent $2,100 out of pocket, your costs will drop dramatically. So you may pay nothing or a small copay depending on what plan you have. So if you have any questions, I think we put a note in there to ask any questions in the chat and we can try to answer them. But some of the decisions you guys make will really impact your healthcare and your max out of pocket or how much you spend out of pocket. So I just wanted to make sure that you can call me with any question, and I promise if I don't know the answer, I know somebody that does. We have such a great network of knowledgeable people that work through national benefit plans, and we are connected to every carrier. And so I just want to encourage you, if you ever have any questions or concerns, what we do is we offer you, partner with you for life. We want to make sure that you understand your plan. If you have any questions, we help you with any claims. And if you ever have any issues with Social Security or Medicare, we can get on the phone with you and call them and try to assist. So again, my name's Vicki Ferguson. I'm with National Benefit Plans. If you're welcome to reach out to me at hello@MB Plans, or you have my office number, which is 248-362-4050. And I just want to say thank you for joining us today. And as long as you guys, I don't see any questions, but we do these events every month, and I try to keep following up with fresh new events so that people can help understand the basics. We can do an event just on Part D drug costs. We want to make sure that you have resources. So if you are tuned into us and you would like to get on our newsletter, you can put your email in our in the chat box and we'll add you to our newsletter. We do a newsletter once a month. Actually, yes, once a month. And we just want to help, so and just be a resource to make sure that you can understand what your choices are as you turn 65. So I want to say thank you, everybody, for attending. And I'm going to go ahead and end our meeting today. I don't see any more hands raised or chats. So nice speaking to you. I hope everybody has a great day.